Thank you. Thanks, Susan, for that introduction. So, taking on from where Dr. Gyan Prakash left, I would be addressing more from the NGO perspective on why we need to have collaborative research. So let me begin with what Kofi Annan said. I think this sort of summarizes what we need to do. And his concept is, in this global world, none of the critical issues that we are dealing with can be resolved within a solely national framework. And all of them require cooperation, partnership, burden sharing, and most importantly, he included NGOs in that framework of collaboration. Both the governmental, NGOs, private sector, and civil society. So that's where we stand today. And my presentation, I would talk about the intersection of NGO activity and research. Coming from my own background, where we have been focusing mainly on activity, the entry into the research aspect of it was an eye-opener. And once we realized what it means, we are firmly going ahead with that. What NGOs can bring to the table, what the researchers contribute, the advantages of collaboration, and of course the challenges that face such collaborations, and moreover the strategies that we can work to promote and sustain such partnerships. We all know that NGOs are conventional agents of community development, successful, working closely with the community, have made significant contribution both in terms of resources, funds, and people. NGOs are activists. So they work on interventions, activities, implementation. These are the key words that the NGOs focus on. Whereas what do academic institutions and researchers bring? They bring about critical thinking, technical skills, credibility, and a long-term view that many a time the activists lack. So NGOs are important partners, moreover working in most countries closely with the government forces, but independent of the government, which is very important. They can be valued partners in health research for the development, right from concept creation to knowledge translation. And these are some of the benefits of NGO partnership in research, because each NGO brings with it the peculiar problems that are faced in that particular community that they work with, which needs to be addressed for overall national development and growth. They can contribute to the transfer of these research findings to the policy makers and thereby bring about actual translation on the ground. They can bring about community engagement and participation, which is key to any real development. The key strengths that an NGO brings on the table: resource mobilization, and resource necessarily does not mean just funds. NGOs are capable of bringing in a lot of resources in kind, which is necessary for the success of any translation in healthcare that is needed, promoting and advocating for relevant health research, the generation, utilization, and management of knowledge and capacity development. They are also well placed to foster public participation in decision. They can provide mechanisms by which such participation is ensured in decision-making process. So as I was saying, the NGOs, because of their very nature of working closely with the community, can both identify problems and actually bring about translation once the research ideas bear results. While the researcher, on the other hand, they're theoretical, methodological, with technical expertise, skills and institutional support, and the funds to carry out research, the ability to access skilled human resource, capacity and motivation to expand knowledge through publication of scientific results. The advantages are, of course, in front of you. Knowledge exchange. This happens while we train research students and also when we sit across the table to design a research project. Improved knowledge translation through increased collaboration with governmental organizations, then thereby help strengthen the long-term impact of such projects. They can increase the access to communities and policy makers. They can help align these programs depending upon what the national policies on the ground are. They increase the acceptance of the community to such projects. They can enhance the capacity building. NGO research collaboration can increase the sustainability and beneficiary participation. Funding, which is a problem for NGOs when it comes to research, because as most of us know, donors are actually interested in having something happening. What are you going to do for me on the field? What is going to be the impact of the project? How many beneficiaries are you going to touch? These are the key questions that most donors raise. And a research project cannot answer such questions. So it is necessary to think in terms of both what the actual implementation is going to be, beneficiary impact. At the same time, look at what the research question is going to address and how it is going to benefit the community in the long run. It provides support to data collection, which we all have realized is primary for bringing about any policy change. I would just take an example of a project that we are working on, that is the Ornet India study, which has been initiated by MRC UK. And there are a group of 20 NGOs that are participating in this, led by Shankar Netralaya, Arvind, LV Prasad. This has led to bringing about 20 NGOs, bringing in their own capabilities, the ability to bring about grassroots change. And the question that they're going to be answering is to evaluate the accuracy of various strategies for screening for diabetes and pre-diabetes. And hopefully the outcome will give crucial insight into the most cost-effective use of health resources and information about potential sources of cost reduction. The challenges, of course, any collaboration is not without any challenge. There is an asymmetric power relation. The researcher has this concept that I'm bringing in the ideas on table, I'm bringing in funds on the table for the research collaboration, while the NGO partner feels that we are the ones who are actually doing work on the ground. We are actually contributing. Can I have just 1 minute more? We are actually, bringing about the change or bringing about the results which the research question demands. So many a time, if there is not good understanding between the partners, this can be a source of power struggle. And the lack of recognition of the contribution made by each partner. Divergent goals and approaches. As I was saying, we always face this. The donor comes and says, what is going to be your impact? How many lives are you going to affect? While the research question, while we were doing our diabetic retinopathy project, the question was about sampling. The research question demanded a very selective sampling, whereas the donor wanted to know, why are you not going to be taking the entire slum community which you're going to work on? Why are you going to only choose 1,500 people in that particular community? So this is again a kind of issue that needs to be addressed in most research collaborations. But some ways are definitely there if you have all your ideas, all your thoughts on table, sit across with the research partner, right from the concept stage, so that the NGO partner can bring in their problems and decide the way forward. So these partnerships are characterized by trust. To conclude, these partnerships can make important contributions to global health research. It is important to identify the conditions and strategies that encourage their success. We need to work more to understand this very complex partnership. And as I was saying, this is the research project on diabetic retinopathy, where we face these challenges between the NGO requirement and the research requirement. Thank you.